Hello and welcome to the Integrated Rehab and Performance Podcast. Just recently changed it up. We are the Integrated Rehab and Performance Podcast now. We will continue to do some episodes on golf for golfers, but we're going to mix it up and add some other variety to the podcast. We'll do some stuff with nutrition and then some other topics that I do with my patients and clients in terms of rehab as we rehab people back from pain, chronic pain, more acute pain and injury, all the way back to performance and doing what they love to do. So with this golf-centered episode today, we are talking about the toe touch test again, but we are going to dive in a little bit deeper into the pelvic mechanics and understanding pelvic control for the toe touch test and how it kind of applies, how we can train and use some things that I use with my patients to address the toe touch test, specifically when it comes to the pelvis. Now, in the past, we've talked about the pelvic tilt test and a couple other rotational tests. So some of these things are going to be similar there, and you can see how this concept kind of keeps coming up, how we need to be able to control our body and especially there at the pelvis, right? So Dr. Nick here, running the show at the Integrated Rehab and Performance Center. Thanks for tuning in. Let's dive in. So the toe touch test, we talked about this last week, and it can get a little complicated. There's a few different things we're looking for with that, but it's more than just the hamstrings, right? A lot of people think that that toe touch or that straight leg raise that we're just assessing, are your hamstrings mobile enough to get in that position or not. But when we go down to do a toe touch, there is a big component of some motor control. So we need a posterior or a backwards weight shift, and that is where we shift our hips backwards, and then we want a uniform spinal curve as we kind of bend down to touch our toes, right? And there's a lot of different things that we want to make sure are going right, and they can tell us a lot of different things as well. All right, so today we want to highlight the pelvis's role in this hinge type motion. So when we can't hinge or shift our weight backwards appropriately or with the correct timing, some common swing faults can pop up, right? So we can either start in a C posture because we can't get our hips to shift our weight backwards, or we don't have the range of motion or the understanding of how to do that. And so we just arch and slouch at the back, right? Creating that C posture at address instead of using the different joints that we have to create that motion. We can also see a lot of loss of posture issues during the swing, the backswing and the downswing, where we have things like early extension, maybe even flat shoulder plane, things like that, where as we're moving dynamically and we're lacking that ability to move well through the hips and shift our weight and hinge at the pelvis, then we start to compensate elsewhere, right? So we'll start to stand straight up more so instead. Our shoulders start to level out instead of pointing more downward. Things like that. These are common swing characteristics that we see with people who have movement deficiencies that we want to work on, like a hinge or a toe touch, okay? Now, some places for us to start is just proper hip shifting and creating relative motion and range of motion in those joints of the pelvis, the sacrum, and the hips, right? So we'll start with the basics here, the pelvic tilting, right? We did that assessment earlier. You can go back and check that out. Some of the things that we want to start with here, if we're seeing some issues with that posterior weight shift in the toe touch test, is start to work on our pelvic tilting, right? So we have things like hook line pelvic tilt, which is the starter, and you would be so surprised to see how many people really struggle to get this motion down. It seems simple, but we just want to make sure that we have the capacity and even the range of motion to do this type of motion, right? And so here we have an example of that pelvic tilt test where we're just laying down in a hook line position here, and we're trying to get as much motion as we can through the pelvis, right? So there I am demonstrating. We don't want to see too much crazy motion happening through here or here, right? We want most of it coming from the pelvis, right? But as we move on there, we can do some 90-90 knee rolls, right? So this is a great exercise to start continuing to build in some of that motion in the hips, right? And again, you'd be surprised at how effective this can be at starting to regain the hip range of motion and an understanding the kind of brain-body connection to orient and move about our hips in this way, right? So here we're coming off the ground, we're kind of digging our heels, we're thinking about pulling our heels down the wall, but the friction is keeping our feet there. What that does, that engages our hamstrings, and we're using the hamstrings there to tilt our pelvis posteriorly just a bit, and we just practiced that in the last drill, right? So here I'm demonstrating we're pulling or pushing down with our heels and our foot, keeping our foot flat on the wall. and that raises our tailbone or our sacrum slightly off the ground, and we posterior or backward tilt that pelvis just slightly. Your belt line should still be on the ground as we do this. And then from here, we're just rolling our knees up and down, right? So one at a time. So I want us to be able to do our right leg independently of our left leg, where we push the right knee towards the ceiling, right? And we don't want that coming from our low back or rolling or anything like that. We want that purely coming from shifting our right hip upward towards the ceiling. And then the same thing, we want to be able to pull that down without our low back rotating or anything like that. We just want to create that space in the hip joint, think about pulling that knee into your hip socket, right? And then just going back and forth and alternating through there. Now we can help things along a little bit and start to address the frontal plane requirements, which is that left and right weight shift with some scissor glides. So now we're doing something very similar. We're just going in the on our side and doing it, right? So this top knee, we want to push forward, and we want that all coming from the hip, right? And you can check out this video on YouTube to get more of the details on it. But we're pushing this knee forward from our hip joint here, and we want to limit how much our torso actually rotates into that. And again, I want you to think about pulling that knee into the hip socket as we come back. I don't want your low back erectors or anything like that doing the work there. I want you to think about just pulling and sinking that hip into that hip socket there. Okay, so here we don't want to round like this. Okay, great exercise to throw into the mix. Try that out. Try 10 to 15 on each side, breathing slowly as we do that. Okay, now a quadruped hip capsule opener with some hip shifting, which is this one that we're going to demonstrate here, is another great drill to start opening up the back side of that hip, freeing up the pelvis so that we can start shifting our weight and our femur into the back of the hip socket, allowing us to hip shift. So from the side here, we have our one leg over top of the other, and then this bottom side knee, we want that foot rotated in towards the midline, right? So this foot would be coming towards the camera, just rotating it a little bit through the hip there. Now as we move forward here, there I am rotating the hip inward. And then you just shift your weight back, and you'll feel it on this right side hip really starting to open in the back of the hip there. And then we want to progress that into doing some hip shifts as we do this. So a good way to see that is from this view here, where you're dropping this free side hip down towards the ground. And then I want you to feel that stretch on the outside of this hip. And as you feel that stretch, you use that tension and that stretch. I want you to think about using those exact muscles and tissue to lift this opposite side hip back up towards the ceiling, right? Then let it shift down. Try not to let your body rotate or bend in any way. We want most of this motion coming right from here, trying to keep your shoulders square to the ground and your hips relatively square to the ground until you start to rotate them like that, and then opening it back up. It's a great exercise, great drill for that. And then let's progress this to standing. We're again in that frontal plane. You can think of it like we're loading up into this right hip in the backswing, and then loading into the left hip in the downswing, right? So from here, we're loading into this hip. I want that knee over the toes. Once we get there, and we're kind of pushing into this hip, right, but keeping an upright torso. And then we're shifting backwards from there. So we load into that. We have our knee out in front over top of our toes, and then from here, we're just shifting directly backwards. Think about pushing this front side of your hip straight back, staying long through the spine as I'm demonstrating there. I want your head and your tailbone, I don't want them ever getting closer to each other. I want them getting further away from each other, right? So what that's saying is don't crunch through the sternum or the ribs or the abdominals there. Stay nice and long as you hinge at that hip, right? This is a hip hinge. It's just what we want to see in the toe touch. And we're focusing and we're practicing and we're working on getting there so that we can actually do that motion after freeing up some of the space through there. And then we're getting really strong through there as well. So again, into the left side, and then you hinge straight back. You should feel a big stretch and opening on the glutes. And then we use that big stretch to start pulling ourselves out of that. Really great exercise there. Okay, last, let's emphasize our ability to control the pelvis, right? So we've addressed mobility issues and started to get some work into those tissues there, but let's get the brain back involved with controlling the motion of the pelvis, especially with the hamstrings and the glutes, right? So again, the toe touch is not just a hamstring flexibility test. It requires a lot of coordination to be present to help get us to create the motion correctly and to do it consistently in the golf swing. So here we're doing a hook line hamstring bridge, where again, we're using the hamstring to control some of the work of the pelvis. And here it's very subtle. So I'm digging my heels and foot into the table a little bit, and then I'm pulling them back, but the friction of the table is keeping my feet right there. From there, we're going to use that tension to lift the the pelvis slightly off the table, right? So just our tailbone and our sacrum slightly off the table with that tilting motion. So our belt line should stay in contact and heavy onto that table. We're just doing a slight lift and tilt right through here. Now the goal of this is to maintain that, but we want that contraction in the hamstrings to be right there as it attaches on the pelvis. We want that to be where most of the where we're feeling most of that contraction and tightness and difficulty. But that is a hard thing to do. It's going to take some practice and some serious brain connection there to get that contraction to come all the way down, and where we can really start to focus it and focus the work of the hamstring right there, right, as we do that. So not easy. It looks easy, but to get the contraction to start happening in the right spot can be really difficult. We have a little posterior tilt there, right? And that's all it is right there, is that little lift off the table there at that low sacrum and tailbone. And then we just want to hold that position 30, 45, 60 seconds as we work on that and our ability to control the pelvis with that proximal hamstring. Okay, and then last, again, working on our ability to control the motion and centrate that femur, is we're doing this DNS 5-month side lying, and we are focusing on the hip here. Okay, so we have our hip at 90 degrees, and then our shoulder here at 90 degrees. And the idea here is to roll over this bottom side hip, and we want to control that motion. So we're always pushing our knee and the outside of our thigh into that ground, right? So we're trying to just push it flat into the floor as we rotate over. So we are controlling our body weight as we roll over that hip with this pressure that we're pushing down into the ground there. Okay, so we're controlling and owning that motion as we roll forward, but we're trying to roll as tight as we can to that shoulder and that hip, right? So not coming way up over our thigh, but trying to be nice and tight through those joints there as we roll over. Throughout this motion, I'm staying as wide as I can in the shoulders, which creates a little motion there. So you'll notice this if you give it a try. Lay on your side and then try to be as wide as you can. Try to get this top shoulder towards the ceiling, and you'll notice that a little space opens up through here as we do that. We want to maintain that. That's what we want. We want to keep it there the whole time as we roll. Keeping this wide shoulder and hip is kind of the way you can think about it, and then maintain all that tension and that width as we roll over, and always pressing 4 out of 10 pressure into that ground there with the outside bottom of our thigh and our knee there. Own it, take a couple breaths here, feel the tension, feel the stretch start to build in the back of the bottom side hip, and then use that tension and that pressure and that contraction to pull yourself back out of it nice and slow, and then open it up through there. Take a breath and then come back down. Again, on the way down, we're always pushing still through here, letting it just build some pressure and tension in that back of the hip as we do that. Great drill for learning to control the hip with those posterior and lateral hip muscles there. And we're teaching the joint and all the stabilizing muscles in that joint to centrate that hip and keep it in the proper placement in that hip so that we have optimal use of it and aren't jamming it up against different structures there as we move along. So a lot of times that's what people struggle with. So it's a great drill to get things to start working and flowing and kind of integrating with all the work that we did previously, right? Putting it all together. It's a great drill for that. All right, so we've addressed the pelvis. If you're struggling with the toe touch or the pelvic tilt test and rotation test for that matter, then you can try these drills as well, combine them with some of those drills from those podcasts, and you begin to see some improvements in your ability to not only complete the test better and more comfortably, but then you should be able to notice you're able to get into your golf positions easier, right? And once we can get into our golf positions easier, and you're noticing, wow, these drills are getting a little bit easier for me, I can focus more on the timing and the swing, right, in your drills, as opposed to the pain I have in my shoulder when I get to the top of my backswing, or how tight my posterior or back of my legs are when I'm trying to get in these positions. And man, I can only do it 4, 5, 6 times before I'm getting so fatigued, because it's so hard to maintain some of these positions and then create power from them. And you'll notice those things start going away, and you need to focus more on your actual practice and swing. And then after that, well, your swing starts to get better and your score gets to get better, right? So this is what we like to work on. This is how we improve golfers: is we adjust the body and then we let the course do the rest of the work for us. Okay. So thanks for listening. Thanks for tuning in. Stay tuned for future episodes coming soon, and we'll start diving into some other topics as well. So pretty excited about that. Thanks. Bye.